spend in a miserable way.
U.S. News Medicare for All emerges as early policy test for 2020 Democrats. The New York Times. By N. Washington U. Senator Elizabeth Warren spoke at length this week about her vision for improving the American health care system, like strengthening the Affordable Care Act and making prescription drugs more affordable. Twice, though, affordable health care for every American is her goal, Ms. Warren said on Bloomberg television, and there are different ways we can get there. To put it another way, I am not walking into that political trap. Ms. Warren of Massachusetts and 3 other liberal presidential candidates support a Medicare for All bill, which would create a single-payer health plan run by the government and increase federal spending by at least $2.5 trillion a year. But Ms. Warren's their activist base, inspired by Senator Bernie Sanders of Vermont, believes that the party should unabashedly pursue universal health care, ending private insurance entirely. But polls indicate Senator Kamala Harris of California drew immediate attacks from Republicans this week by taking on the issue that Ms. Warren dodged. Ms. Harris breathed. Her remark triggered an intra-party debate about an issue that until now had been largely theoretical a decade after Democrats pushed through the most significant expansion of health care since the Great Society. Should they build incrementally on the Affordable Care Act or scrap the insurance sector entirely and create a European-style public program? 4 Democratic presidential candidates: Ms. Harris, Ms. Warren, Senator Kirsten Gillibrand of New York and Senator Cory Booker of New Jersey are among the co-sponsors of Mr. SADIS, which would replace the Affordable Care Act with a single government health plan for all Americans. Medicare is the concept of Medicare for All has become popular with Democrats. 81% support it, according to Yet voter opposition. For now, as Ms. Warren demonstrated, many candidates do not want to wrestle publicly with the details. After Ms. Harris, yet there is one likely 2020 contender who is thrilled to discuss Medicare for All. Mr. Sanders, in an interview, did not mince words. The only role for private insurance in the system he envisioned would be cosmetic surgery. You want to get your nose fixed? Every candidate will make his or her own decisions, Mr. Sanders said, but if I look at polling and 70% of the people support Medicare for All, if a very significant percentage of people think the rich, the very rich, should start paying their fair share of taxes, I think it'd be pretty dumb not to develop policies that capture what the American people want. But Michael R. Bloomberg, the former New York City mayor who is considering a 2020 bid on a centrist Democratic platform, said it would be folly to even consider a single-payer system. To replace the Congressional Budget Office has not scored Mr. SADIS Medicare for All bill, that by the Mercatus Center of George Mason University predicted it would increase federal spending by at least $32.6 trillion over the first decade. The cost could be the divide between Mr. Sanders, a Democratic socialist, and Mr. Bloomberg, a Republican-turned-independent-turned-Democrat, reflects the large chasm in a party that has been reshaped by President Trump. The president's hardline nationalism has simultaneously nudged Democrats to the left, emboldening them to pursue unambiguously liberal policies, and drawn independents and moderate Republicans to the party because they cannot abide his incendiary conduct and demagoguery on race. These dueling forces and these divisions extend to what is wisest politically. Liberals argue that the only way to drive up turnout among unlikely voters or win back some of the voters uneasy with Hillary Clinton's ties to corporate interests is to pursue a bold agenda and elevate issues like Medicare for All. Those who run on incremental changes are not the ones who are going to get people excited and get people to turn out, said Representative Premila J. Apple of Washington, the co-chair of the Congressional Progressive Caucus. And by preserving their options, Democrats risk alienating liberal primary voters, some of whom consider support for Medicare for All a litmus test. The center is not a good place to be on these policies anymore, said Mary O'Connor, 61, a substitute teacher and horse farmer in Middleburg, Virginia, who wants a single-payer system. He'll be watching, but moderates believe that most Democratic primary voters are you and that terminating employer-sponsored insurance would only frighten the sort of general election voters who are eager to cast out Mr. Trump but do not want to wholly remake the country's healthcare system. Most of the freshmen who helped take back the House got elected on "we're going to protect your health insurance even if you have a pre-existing condition, not we're going to take this whole system and throw it out the window," said Kenneth Baer, a Democratic strategist. While polling does show that Medicare for All is a buzz phrase that has lately been applied to everything from single-payer healthcare to programs that would allow some or all Americans to buy into Medicare or Medicaid, has broad public support. Attitudes swing significantly depending on not just the details, but respondents' age and income. On the House side, a Mr. Sanders is under revision and will soon be reintroduced with Ms. J. Apple as the main sponsor. Other Democrats, the buy-in programs would generally cover between 60 and 80% of people's medical costs and would require much less federal spending because enrollees would still pay premiums and not everyone would be eligible. Some proponents, Mr. Sanders has, such as a new 7.5% payroll tax and a wealth tax on the top 0.1% of earners. He has also but Robert Bledo, the health policy professor at Harvard who studies public opinion, said it would be wise not to delve into financing details for now. The reason it failed in Vermont and Colorado was taxes, Professor Bledo said, referring to recent efforts to move to a near universal health care system in those states, which flopped resoundingly because they would have required major tax increases. But Democratic, the general election will be a different story, Professor Bledo added. If Ms. Harris, the difficulty for Democrats, added Ezekiel Emanuel, a former Obama healthcare advisor, is that many voters look at the healthcare system the same way they view politics. They say Congress, according to the Gallup poll, 70% of Americans with private insurance rate their coverage as excellent or good. 85% among those who make over $90,000 a year the sort of voters in the House districts that several Democrats captured in the midterms. Those surveyed in the Kaiser poll were particularly wary of an all-government system. 64% in this income group said they would oppose a Medicare for All plan that terminated private insurance. "My constituents are tired of bumper sticker debates about complex issues," said Representative Lizzie Pannill Fletcher of Texas, a freshman from an affluent Houston district. "We don't want ideology in Vermont, where former government." Peter Schimmelfer, Dr. Deb Richter, a primary care doctor who said that while the Democratic field is going to have to face the T-word, being upfront about the required tax increases, she now thinks phasing in a government-run system is a better approach. "There's ways of doing this that have to happen all at once," she said, pointing to a push in Vermont to start with universal government coverage for. "But you need to talk."
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.